Hello everyone, this is Dr. Hasanat. All of you are welcome to my today's lecture. Basically today I'm going to talk about the principle of dynamics of circulation or principle of hemodynamics. Okay, so dynamics means study of motion. So circulatory dynamics or hemodynamics refers to the study of movement of blood through circulatory system. It includes flow of blood or blood flow rate, velocity of blood flow, pressure, compliance, resistance. So first of all, it is important to distinguish between velocity and the blood flow rate or blood flow. Velocity is defined as the rate of displacement of fluid with respect to time. This is expressed as distance per unit time. For example, in centimeter per second. Whereas blood flow rate or blood flow is defined as the volume displacement per unit time, that is expressed in centimeter cube per second. Relationship between velocity and flow can be expressed by the following equation. Velocity V is equal Q divided by A. Therefore, Q is equal A into V, where V is the velocity that is expressed in centimeter per second, Q is the blood flow rate, that is milliliter per minute, and A is the cross-sectional area that is expressed in centimeter per second. So from this equation, we can say that this velocity is directly proportional to the blood flow. That means if the blood flow increases, that also increases the velocity of the blood. And this velocity is inversely proportional to the cross-sectional area. That means if the cross-sectional area increases, velocity will be decreased. But in case of reduced cross-sectional area, then the velocity will be increased. So here is the relationship. Here you can see clearly that velocity is directly proportional to the blood flow and inversely proportional to the cross-sectional area. So this too important is very, very important. Now here you can see that the cross-sectional area of different vessels, because as you know this is very important, is because the velocity depends on the cross-sectional area. If you see carefully, then you can observe the aorta have the lowest cross-sectional area, that is only 2.5 centimeter square. That means the velocity in the aorta, that is maximum. But you can also observe that gradually if you approach from aorta to the capillary, this cross-sectional area that increases. Say in the small arteries, the cross-sectional area is 20 centimeter per square. In the arterioles, it is 40 centimeter per square, and the capillary, there is a maximum cross-sectional area that is 200 and 500, 2,500 centimeter square. So actually, this is not the cross-sectional area of the single capillary, or it is not the cross-sectional area of single arteriole. It is actually, if you make a bundle by all the capillaries of your body and then measure their total cross-sectional area, then you will find this value, that is 2,500 area. Similarly, arterioles, this cross-sectional area is not for a single arterioles. It is the total cross-sectional area of all the arterioles of your body. So actually cross-sectional area that will gradually increases, so the velocity will drop and the velocity will be least or minimum in the capillaries, and that is important for the gaseous exchange of nutrition. Okay, and again you also observe that from the venous end of the capillary, as you approach towards the heart, the cross-sectional area again increases. Say it is in the venule, it is sorry, cross-sectional area gradually decreases. In the venules, it is 250. The small vein, it is 80, and the vena cava, it is 8. That means cross-sectional area decreases as you approach toward the heart. So the velocity will be increased as you approach towards the heart. Okay. Another observation that the cross-sectional area of the aorta and the cross-sectional area of the vena cava, you can observe that the cross-sectional area of the vena cava, it is almost double about the cross-sectional area of the aorta. So the velocity in the vena cava, it is half of the velocity of the aorta. Okay, so that is very important. If you have the idea of cross-sectional total cross-sectional area of the different vessels, then it will be easy for you to understand whether the velocity will be increases and whether the velocity are less. Okay, now therefore the average velocity of blood is high in the aorta, and velocity declines steadily in the smaller vessels and is lowest in the capillary due to progressive increase in the cross-sectional area. Just I have shown the different cross-sectional area of different vessels. Again, the velocity slowly increases as blood passes from venule through the vein into the vena cava, which occurs due to gradual decrease in cross-sectional area of this vessel as they approach the heart. So just I have explained this thing. And near the heart, the total cross-sectional area of the great vein is nearly double that of the aorta. Hence, the velocity is about half. Is it clear? Okay. Now, the next point, in the proximal portion of the aorta, velocity ranges from 120 centimeter per second during systole. You know, during systole, the velocity, it will be the maximum. Okay. And then the velocity will drop and drop to a negative value at the time of transient backflow before the aortic valve closes in the early period of diastole. So when your ventricle undergoes diastole or relaxation, there will be a certain transient period of time, a transient period when there will be backflow. So at that moment, the velocity will be zero, or it may drop to a negative value. Okay, so in the period of early diastole. Now, actually the velocity, actually there is a phasic change in the velocity of the blood flow. Blood flow in the large aorta at a greater speed during systole, because during systole, a greater force is produced by the ventricular contraction. Okay, so the velocity will be maximum than during diastole. Okay, now another thing, when the laminar flow occurs, the velocity of flow in the center of the vessel is far greater than toward the periphery. That means if you consider a river, the velocity of the flow, it will be maximum at the center of the river, but it is lowest or minimum, okay, near the edge or near the wall of the blood vessels. Is it clear? Now, say it is for your self-assessment. The velocity of blood flow is number 1, 0 centimeter of water per second in ascending aorta during early diastole. Now put your comment, it is true or false. Okay. Second option is higher in the capillaries than the arteriole. Third option is higher in the venules than the arteriole. Fourth option is inversely proportional to the cross-sectional area of the blood vessels. Fifth option is higher in the vein than the venules. I think you can answer all these things. Okay. Now we can match your answer with my answer. Then number 1, it is true. Second option, it is false. Third option, false. Fourth option is true. Fifth option is also true. Okay, I have already explained all these things. Now the another question for your self-assessment. The velocity of blood flow, in the option A, the velocity of blood flow in the capillaries is low because they offer high resistance to flow. Option B, in veins is greater than in venules. Option C, can fall to zero in the ascending aorta during diastole. Option D is greater towards the center of the large blood vessel than at the periphery. Option E, in the circulation, it is false as the hematocrit falls. Okay. So let's check the answer. Option A, it is false because the velocity is low because the capillary bed has a large total cross-sectional area, not due to the high resistance. Okay. B is true, C true, D true, option E false, because actually velocity is related inversely with the viscosity or hematocrit. Okay. Now, the next topic I'm going to talk about, that is types of blood flow and Reynolds number. Basically, there are two types of blood flow. The normal blood flow is called laminar flow. Laminar means in layers. So normally, flow of blood in the vessels is laminar in nature. Laminar flow is also called the streamline flow. Okay, and it do not produce any sound. So it is actually silent. So here you can see there is a parallel layers of the flow of blood, and if you see carefully, then you will observe that the layer, a very thin layer that lies very close to the wall of the blood vessels, the velocity is almost zero or very minimum. But the next layer that moves with a less velocity, but gradually towards the center of the stream, the velocity increases. Okay, so at the center, the velocity is maximum. So this is actually parabolic pattern. Okay, the velocity is maximum at the center and lowest at the periphery. So this is actually called the laminar blood flow. Flow of blood in layer by layer. Okay. Now the layer of the blood flow which is in close contact with the wall of the vessel does not move at all due to the frictional resistance with the vessel wall. So the next layer moves with a lesser velocity. The velocity slowly increases towards the center of the blood vessels, and the velocity is maximal in the central layer of the blood in the vessels. Is it clear? So this is simply called laminar blood flow. Now, what is turbulent flow? Another type of blood flow that is known as turbulent flow. So that is not the normal. When there is interruption of the laminar blood flow, there may be a turbulent flow. So what is that? Basically, laminar flow occurs up to a certain velocity beyond which the flow becomes turbulent. The velocity above which the flow is turbulent is known as critical velocity. Okay, so up to a velocity, up to a certain velocity, the flow will be laminar, but beyond that velocity, the flow will be turbulent. Okay, so here you can see there is a tube and the fluid is flowing through the tube. Initially, it was laminar, but when it is passing through a partially obstructed area, this laminar flow is disrupted because due to narrowing of the lumen, this velocity increases and the flow becomes turbulent. Okay, and this turbulent flow produces sound. Okay, now the probability of turbulence is expressed in terms of Reynolds number, which is calculated as Re, and which is directly proportional to the density of the fluid and the diameter of the tube and the velocity. Okay, but this Reynolds number is inversely proportional to the eta. That means it is the viscosity. That means if the viscosity increases, this Reynolds number decreases, the probability of the turbulent flow will be decreasing. But if this viscosity decreases, this this Reynolds number, it will be increases, and that will increase the possibility of the turbulent blood flow. Okay, so usually when the Reynolds number is less than 2000, the flow is laminar, and when the Reynolds number is more than 2000 or 3000, the flow is turbulent. So in the cardiovascular system, at the site of constriction or at the site of bifurcation, or where the branching occurs, there the increase in the velocity of the blood flow makes the flow turbulent. So turbulence of flow produces sound. If it is cardiac origin, then it is called murmur, and if it is heard over the artery or vessel, that is called bruit. And also, you know that during the measuring of the blood pressure, the sound we hear that is produced by the flow of blood through the partially obstructed the brachial artery, that sound is known as korotkoff sound. Okay, so this is the, if you see this picture clearly, you can see this is the streamline flow. The flow occurs in the layer by layer. And the second picture, there is a turbulence. There is a whirlpool. Okay, the flow is not laminar, so this is called turbulent flow. So what are the basic differences between laminar and turbulent flow? You know the nature of the flow. In case of laminar flow, it is occurs in layers or streamline flow, but turbulent flow, there is no layers. The flow is disturbed. And second point, the velocity of flow, in case of laminar flow, it is below the critical velocity. But in case of turbulent flow, it is above the critical velocity. And in case of laminar flow, Reynolds number remain below 2000. But in case of turbulent flow, this Reynolds number actually become more, above the 3000. Okay. An association of sound, you know the laminar flow do not produce any sound, that is, it is soundless or silent, but turbulent flow always produce sound, so it is associated with sound like murmur, bruit. Okay, so now the next point is very, very important, that is peripheral vascular resistance or PVRs. So what is resistance? Resistance offered to the flow of blood in the peripheral circulation is simply called peripheral resistance. So how this resistance results? Resistance occurs as a result of friction between the flowing of blood and the intravascular endothelium. I repeat again, resistance occurs as a result of friction between the flowing of blood and the intravascular endothelium. That means if there is more friction, the resistance will be more. If there is a less friction, resistance will be less. Okay. So now, Poiseuille's equation gives factors that change the resistance of the blood flow. So here you can see the equation. This resistance is directly proportional to the viscosity of the blood, that is expressed in eta. And this is the L that indicate the length of the blood vessels. So if you increase the length double, the resistance will be double. If you increase the viscosity by 2 times, the resistance will also increase 2 times. But these factors are not very important to control the resistance, because in the normal person or normal condition, these factors are almost remain constant. Okay, so resistance is mainly controlled by the diameter or radius of the vessels, and resistance is inversely proportional to the 4th power of radius. So that is very, very important. So if you increase the radius or diameter 2 times, the resistance, it will be increased 16 times, because 2 to the power 4, that means 16. So it will also increase the blood flow by 16 times. And the reverse thing will happen. If you reduce the diameter by half, the resistance will increase the 16th time. And the blood flow decreases by 16 times. Okay, so actually this peripheral resistance is mainly controlled by the radius of the blood vessel, because you know this blood vessels that is supplied by the sympathetic nervous system, so it can constrict or dilate the vessel, thereby regulate the diameter of the vessels and finally control the resistance of the body. Okay, now so resistance is directly proportional to the viscosity of the blood, as we have seen in this equation. For example, increasing viscosity by increasing hematocrit will increase resistance and decrease the blood flow. Okay, so resistance is directly proportional to the length of the vessels. I have already explained. Resistance is inversely proportional to the fourth power of radius. Is it clear? So decrease in radius of blood vessel to half increases peripheral resistance by 16 times. Conversely, when the radius is doubled, resistance is reduced by 16 times. So thereby increase the blood flow 16 times. Because you know, blood flow and resistance, they are inversely related. Vasoconstriction increases and vasodilatation decreases peripheral resistance. It is so simple. Now, I want to mention some other factor that also influence the peripheral resistance, like the velocity. Here I have shown you some important factors like velocity. If there is velocity is more, there will be a more friction between the molecules of the blood and the wall of the blood vessels or endothelium, so the resistance will be more. Okay, if the viscosity increases, again there will be a more friction between the molecules of the blood and the endothelium, so resistance will be more. But so these first two factors, they are proportional, directly proportional with the resistance. But this last two factor, that is elasticity of the arterial wall and lumen of the blood vessels, they are inversely related to the resistance. That means if the lumen, by this time you have already know this is resistance basically related to the fourth power of the radius. Okay, so if the elasticity is lost, the resistance will be increased. That happen in the advanced age, thereby increases the blood pressure. Is it clear? Okay, now this is for your self-assessment. There is a question. We'll put your answer by true or false. The resistance to blood flow is directly proportional to option A, viscosity of the blood, option B, length of the blood vessel, option C, velocity of the blood flow, option D, elasticity of vessel wall, and option E, fourth power of radius of the blood vessel. So I think you have already make your idea what will be the answers. So just check it now. That is, first option is true, second option is true, third option, that is first three options are true, and the last two options are false. Now, let me tell you something about the viscosity, how viscosity affects the resistance. Okay. Actually, viscosity mainly depends on the factors like hematocrit, composition of plasma, resistance of the red cells to deformation, and temperature. So here you can see that actually viscosity increases in polycythemia due to increased red cell productions. Okay, so viscosity increases, but in case of anemia, the number of red blood cells are less, so the viscosity will be decreased. So in the anemia, as the viscosity decreases, so the velocity will be increased and the circulation will be hyperdynamic. Okay, and you know, if the viscosity is less, there will be less peripheral resistance, increased velocity, and there will be hyperdynamic circulation. Now another point, the concentration of plasma protein that affects viscosity. Viscosity increases in condition in which concentration of plasma protein is more. As for example, in paraproteinemia, the multiple myeloma, there is an increase in myeloma protein. So the viscosity will be increased. On the other hand, viscosity decreases in hypoproteinemia. So the peripheral resistance will be decreased in the case of hypoproteinemia. And the next factor is resistance of the red cells to deformations. When the red cell become rigid, as seen in hereditary spherocytosis. So as due to this deformed RBC, the viscosity increases and thereby increase the peripheral resistance. And the last factors, that is increase in body temperature decreases viscosity and thereby decrease peripheral resistance. Other hand, peripheral resistance decreases in temperature increases viscosity. Okay. That means body temperature decreases, increase in body temperature, viscosity decreases. But decrease in temperature, increase viscosity. So there is an inverse relationship between body temperature and viscosity. Now, I want to give you another idea, very important. Smaller branches receive blood containing less red cell. Here you can see in this figure, this is the main artery, they contain lots of red blood cell, but in comparison, these branched vessels that will receive receive less RBC. So the hematocrit value falls in the capillary, or that is 25% less than the whole body hematocrit. So this is phenomenon is called plasma skimming. Thus, the smaller branches receive blood containing less red blood cell. This phenomenon is called plasma skimming. This explains why the hematocrit of capillary blood is about 25% less than the whole body hematocrit. Now, the most important equation known as HAGEN-POISEUILLE equations. This equation which explains the relationship between different variables of the dynamics. According to Poiseuille's equations, the volume of blood flow, that is Q, flowing through a rigid tube is directly proportional to the pressure gradient. So if there is a more pressure difference between the two ends of a vessels or in a rigid tube, so that will increase the flow of blood. Again, this blood flow is directly proportional to the fourth power of the radius. I have already explained, if the radius increases, the blood flow will be increased definitely. And the third point is it is inversely proportional to the length of the tube. So this is the equations state between the relationship between the blood flow, pressure difference, radius, and length. So here you can see this Q, that is the blood flow, it is proportional to the pressure difference and proportional to the fourth power of radius and inversely proportional to the length. And K is actually, it is a constant and indicates actually it is the constant temperature of the flowing fluid. Okay, but this constant K is expressed as the reciprocal of viscosity. So that means if you put this value in this equation, this K is expressed as reciprocal of viscosity. That means it is inversely related to the viscosity. So you will get these equations. Now this Q is equal del P, pressure difference, into fourth power of radius and divided by length and the viscosity. Now, another value that is pi divided by 8, it is actually arithmetic value derived while determining the volume of fluid flowing in a given unit of time. So now the equation, it would be like that. This Q is equal pressure difference into fourth power of radius, proportional to the fourth power of radius, and inversely proportional to the length and eta and pi by 8. So now the final equation will be about del P pi r to the power 4 divided by 8 L and eta. So this is the Poiseuille's equation. So the blood flow is directly proportional to the pressure difference and proportional to the fourth power of radius, but inversely proportional to the length and the viscosity of the blood. So this is the Poiseuille's equation, and we also know the blood flow is equal del P, or pressure difference divided by resistance, which is actually according to Ohm's law. The flow of current, you can calculate the flow of current by dividing the potential difference by the resistance. Okay, so the resistance is equal del P by F, and if you put the value of F here, you will get the value of resistance. I have already explained. This is the resistance is directly proportional to the viscosity and length of the blood vessel, but inversely proportional to the fourth power of radius. So from this equation, you will understand the relationship between blood flow, pressure difference, viscosity, length, and radius of the blood vessels. Okay. So if the blood vessel is locally dilated, then the velocity of the blood flow is decreased. If the blood vessel is locally constricted, then the velocity of the blood flow is increased respectively. So this principle is very helpful in the maintenance of blood flow in the locally constricted blood vessel due to atherosclerotic invasions. This is actually according to the Bernoulli's principle. So try to understand when any vessels undergo atherosclerotic change, that means the lumen become narrow or vessel become constricted. So to maintain the adequate perfusion, this velocity will be increased. As the narrowing of the lumen, that will increase the velocity, and that is necessary to maintain the blood flow constant. Okay. Now the last topic today I am going to explain, that is compliance of the vessels or capacity of the vessels. Actually, arteries, thick arteries contain thick walls with extensive elastic tissue and smooth muscle, so they can be distended by higher volume. But due to their recoil effect, pressure will be increased significantly. That means arteries, due to their elasticity or due to their thick smooth muscle in the structure of their wall, they can accommodate the extra volume of blood, but at the cost of increased pressure significantly. Okay, so the blood volume contained in the arteries is called the stress volume, so they are less compliant. Okay. Now, in case of venous system, this vein, actually there is thin smooth muscle layer in their wall, and their elasticity is less than the arterial system. So they can be distended by the higher volume, but their recoil effect is very less. So they remain distended. Okay. So they remain distended without any significant increase in pressure. So the volume contained in the vein is called unstressed volume. That is why these veins are highly compliant. That is actually 24 times compliant than the systemic arteries. So here you can see this vascular compliance is equal, that is change in volume and divided by change in pressure. Okay, if the volume is increased without any significant change in pressure, that means there will be more compliance, vascular compliance is increased. But if this volume increases with significant, that also causes the significant increase in blood pressure, that means the vascular compliance will be less. Is it clear? So compliance is equal, V means volume change divided by pressure change. If the volume change without any significant pressure change, that indicates more compliance. But if the volume increased with a significant increase of blood pressure, that means the compliance is less. So the compliance is inversely related to the elastance. Okay, so if the more vessel is more elastic, there will be more recoil back, or they will push back or recoil back, and that will cause that will increases the pressure, and that will decreases the compliance. Is it clear? So that's all for today. Thank you very much.